talk about a disease which is a dimorphic fungal disease, histoplasmosis, guys. And histoplasmosis is being done by Histoplasma capsulatum. Okay. And the interesting thing is that Histoplasma capsulatum does not have a capsule. It leads to this particular disease, histoplasmosis, which is also termed as Darling's disease. And the discoverer was there, named scientist that is named as Darling, only Samuel Darling. And thereby this particular disease is also termed as what? Darling's disease. Okay. And telling about the various like sequence, how does the infection happens of all of them. So guys, important is the same sequence is being followed for all. And what is that sequence? The inhalation of the spores mostly happens in most of the dimorphic fungi. Okay, so the inhalation of the spores, and these inhalation spores might be from where? From the fecal material of certain birds, poultry birds and all that. This particular fungal infection is endemic in the particular region of Ohio and Arizona in America. So this is also termed as endemic mycosis. Okay, this is also termed as what? Endemic mycosis. And these particular spores which are being inhaled, they go to the lungs, and in the lungs, the alveolar macrophages, they phagocytose them, and there in the macrophages itself, they change up into what? Yeast forms. Okay, they change up into what? Yeast forms, and these particular yeast forms, they survive within the phagolysosome of them by producing what? Alkaline substances. Okay, and then these intracellular ones, these intracellular yeast cells, they go to the lymph nodes and then spreads to the other parts of the bloodstream. Fine. And even you can observe them into the bone marrow. And this particular picture mostly comes up in the questions also. They show up the bone marrow cells, bone marrow biopsy cells, in which you can able to find these yeast cells. And I just told you the yeast cells are at which particular temperature, guys? At 37. Is it fine? So this is what is there which you need to know in the case of histoplasmosis or any other dimorphic fungi. Mostly the infection of systemic stuff happens this way. Okay. And later on it involves the viscera and all by the blood, even go to the bone marrow, just I have told you, and that's why it is termed as what? Systemic mycosis. That's why it is termed as what, guys? Systemic mycosis. So if somebody asks you that which is the most common form of histoplasmosis which is observed, the answer is pulmonary histoplasmosis is the most common which is being observed, and you can able to find in the chest x-ray the pulmonary infiltrates. Okay. And secondary to the lung involvement, what is present, guys? The skin involvement is common, and it can present with umbilicated nodules over the face and over the body also. Okay, so that is our observation observed in the histoplasmosis, cutaneous histoplasmosis, that is umbilicated nodule and all.